Welcome back, everyone. Do you have plans to be outdoors this weekend? Well, do me a favor. Please don't forget the sunscreen. May is Skin Cancer Awareness Month, and I recently spoke with Dr. Sujatha Reddy about how we can protect our skin against the harmful rays of the sun and warning signs to look for. Dr. Reddy, I'm so happy we're talking about such an important topic. First and foremost, how common is skin cancer?
So in reality, skin cancer is the most common type of cancer. So the good news there is there are some very curable, what I would kind of say are, if there is such a thing, a minor kind of cancer when you're associated with skin. But there are the deadly kinds of cancers associated with skin, like melanoma. But skin cancer is the most common type of cancer.
You know, Dr. Reddy, years ago, when I first started, 25 years ago, I was tasked with doing a series on skin cancer, and I met this man who lost his beautiful wife to melanoma at a very early age, and she was in the category that is considered most at risk. She had red hair, very fair skin. So talk more about that. Is that still the case in terms of, who is most prevalent in getting skin cancers?
You're 100% correct what you said. So being fair-skinned or light-skinned is absolutely a risk factor. People with dark skin absolutely get skin cancer too, but it's less common. Also, UV exposure puts you at risk. A family history can increase your risk.
And you mentioned making sure that we go to get ourselves checked out. Let's talk first about self-exams. What do we look for? How do we know if something, looks a little bit dangerous?
So the place to check is going to be sun-exposed areas, your arms, your feet, your lower legs, your face, things, or your neck, your chest, places that you can easily look at. And you're going to look for any sort of new skin problems or lesions, moles, if you want to call it that. We've heard of this before, but I'm going to reiterate it. It's the ABCDE of moles or skin lesions. A stands for asymmetrical borders. It's not perfectly round. It may have a lumpy edge. It may be like more of an unusual shape. B would be the border. It's not smooth. It's irregular. C would be the color. It's not uniform. The color is darker in one spot, faded in another spot, or the color is changing. D stands for diameter. You want to have anything bigger than a pencil tip eraser, about 1/4 of an inch looked at. That's the diameter. And E for evolving. It's growing. The borders are becoming irregular or bumpy. Anything that's changing should be looked at. Some dermatologists actually recommend getting an annual checkup if you have moles or skin lesions, starting in your mid-20s, and you go once a year for what they call a pigmented lesion check. And they can do a much more thorough job than we can do ourselves, because you can't look on your back. You can't look in the back of your scalp or areas you can't see. But definitely, like you mentioned, starting with self-skin exams is the best place to start.
One of my girlfriends, they found something in between her toes. Again, it's not a place you would even dream of looking, but that's why it's just so important to have those yearly exams. And then lastly, let's talk about how we protect ourselves, of course, SPF, but you and I have actually talked about this in years prior. There's the 100 versus the 50. What's the best number?
So, that's a great question. And over the years, they've actually recommended we stop worrying about the number over 50. 50 now is usually the highest number you can get. You want to get one that blocks UVA and UVB. I would do a minimum of 15 to 30. If you can go higher, great. But the main thing with whatever sunscreen, sunblock you use is you have to reapply it about every 2 to 3 hours. And that's where I think people, forget or get lazy. They put it on in the morning, but then they don't do it again. It's the reapplication that's the key. Also, don't forget mechanical barriers, physical barriers like long sleeves, a hat will keep sun off you. So, blocking the sun from your skin is the way to go. If you've already had atypical or abnormal moles, you're at higher risk. So you really probably should just avoid the sun if you can.
Well, I so appreciate it. As always, this is the season for fun in the sun. So this is vital information for all of our viewers. Thank you so much for your time. We so appreciate it.
Thank you, Christine. Always a pleasure.
All right.